Well, good morning and welcome back. I am joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for joining us today.
Yeah, thank you.
Today we're talking about lung cancer. November, Lung Cancer Awareness Month. And is lung cancer something only smokers need to worry about, or more of us as well?
Well, no, while it is the leading cause of cancer death in both men and women, so above any other death from any other cancer in either gender, it actually tends to occur not just in smokers, although smoking does increase your risk anywhere between 15 to 30 times. It also occurs in non-smokers.
And then what are the risk factors for lung cancer?
Well, smoking, but also secondhand smoke, so working around smoke, living in a home where somebody smokes, tobacco smoke, be it cigarettes, pipe tobacco, cigars, they actually carry in it chemicals themselves, 30 different kinds of chemicals or more that can increase your risk of getting lung cancer. But also radon exposure. Radon is an odorless gas that comes from rocks and can get trapped in many basements in our homes. And then smaller substances that we may be exposed to, like in the workplace. So asbestos or silica that can come like in auto body shops, diesel exhaust and things like that.
What are some of the symptoms that you might have?
Well, unfortunately, there aren't very many early symptoms. Most of the time people, if they are having symptoms, it's at a very advanced stage of cancer, so it makes it really difficult. It might be a chronic cough, sometimes people might have, or coughing with a little bit of blood in there. It's called hemoptysis, unintentional weight loss, or recurrent pneumonias.
So how does one decrease the risk of getting lung cancer?
Well, quitting smoking actually can decrease your risk a lot. Doesn't bring it to zero.
Right.
It's not the same risk as a non-smoker, but it actually dramatically decreases your risk of getting lung cancer. Also recommend to test your home for radon. The EPA can come out to your home. There are radon test kits that you can get. And just being aware of workplace exposure, taking it upon yourself to make sure you're protecting yourself with respirators if you're exposed to any of these other substances.
Is there any good screening available?
Well, there is some screening available. And the screening, remember, screening tests are really best done in people who are at highest risk. So screening is recommended for people who are heavy smokers, so 30 pack years. That means 1 pack a day for the last 30 years, between the ages of 55 and 80. And it's an annual low-dose chest CT that is low radiation chest CT that's recommended.
All right, well, thanks for sharing some of those tips with us here this morning on Morning Rounds. And if you have any questions that you would like answered, you can just email them right to us. Email address right there, morningrounds@kpax.com.